Welcome. I will introduce here TomoFlow, the imaging flow cytometer for the years ahead. Essentially, we have the ambition to make the new generation imaging flow cytometer the global standard for studying cells in 3D without dyes or fluorescent markers. So we believe that we can have chances to surpass the current state of the art in flow cytometry and avoiding limitation in cell analysis. And we believe that we can open new scenarios in such kind of biomedical field. If you look at state-of-the-art image flow cytometry, it combines flow cytometry with microscopy based on fluorescent analysis. However, there are limitations of fluorescent microscopy as we know. In our case, instead, the resolution is completely label-free. That means that we can observe and measure the cell also inside by measuring accurately the 3D morphology and also the refractive index. And so visualizing, quantifying any intracellular structures, including lipid droplets, vacuole, or exogenous nanoparticles. The solution it can be achieved thanks to the patent portfolio about angle recovering intracellular specificity that allow us to transit from this 3D refractive index to accurate evaluation and localization of intracellular particle in this case. In this case, you can see nucleolus, in this case, lysosomes. So we are looking for the first imaging flow cytometer produced by TomoFlow that will have the feature to be label-free, 3D, quantitative, biophysics, and computational specificity. And mostly important, we already proved the possibility to correlate genetic as well as pharmacological intervention of single cells thanks to the quantitative information of each one of the cells passing along our flow cytometer. So if we look to the TomoFlow, we can see wide range of application going from liquid biopsy, drug screening, cell phenotyping, cell diagnosis, cell bioengineering, and other things. And here you can see some representation of a 3D refractive index of many different kind of cells. And nowadays we have a quite large database atlas of more than 30,000 cells for more than 70 cell lines. We believe that there are great opportunity in the market, and our ambition is to intercept between a percentage between 2 and 5 in the market penetration. That can be the possibility to get revenue between 10 and more than 30 millions per year. Essentially, we are very aware of the barrier to competition. We made a very strong and analysis of the possibility, but to our strength, the possibility that TomoFlow is a game-changing tech, as we have all the features that can be desired for a kind of flow cytometer, label-free, 3D, specificity, and quantification. We developed also a business model just to get a core revenue stream after 2 years, just starting with participation to research product, also other kind of activity. We have a very clear idea also which are our primary target customers, pharmaceutical, clinical, and academics. So we need funding for making all this stuff, and just to make sure that we'll do that. We have a strong portfolio in terms of know-how and patents, and in addition, we have a very strong team that supported this kind of activity, and also young researchers that can transit into TomoFlow R&D teams for the near future. As final things, we developed also a virtual reality capability suite of the platform that can allow us to analyze in quantitative way in realistic 3D environment all the information related to these kind of things. So thank you very much for your attention about TomoFlow.